Hi, so I'm Dr. Munir Ravalia. I'm a general dental practitioner, and I've always been interested in the use of sort of alternative therapies in healthcare. Um, and I came across who's now become a good friend of mine, James from the Be Vital company, who produces Propolis in various forms. But I was very interested in their oral health range. And so together over the last couple of years, we've been working together to see how we can develop this range that was already there and how we can sort of allow patients to have self-care with that, but also utilizing it and expanding it so dentists can further their knowledge and assist their patients with the use of various products with propolis in it. So during the sort of development of products, we also wanted to ensure that we had and have research to back up the sort of the products and claims that have been made with propolis, and therefore, with some international colleagues, of course, based globally, we were able to write a paper, sort of a meta-analysis, analyzing all the papers and data out there on the use of various propolis products in oral health care. And I feel this is quite a nice summary because it takes all the different data and we've analyzed it and assessed it to give the best evidence base for the use of our products, which is obviously very important for not only dental practitioners to be able to guide their patients, but also for individuals who may be researching themselves. This paper sort of summarizes and allows them to then have the best evidence base to use the different products that they may feel useful for themselves and their friends and family. We've also updated a book that was written by James and Dr. Wanda, who's a retired practitioner, and he successfully used propolis in oral health care for many years and taught many colleagues and practitioners the use of the different products in the dental surgery, and he was really a pioneer, so we're obviously grateful for his assistance. And the updated book, I feel, is quite user-friendly because it sort of summarizes again the paper that we've written, but it also summarizes sort of an easy guide for dentists to be able to use in the surgery, making it very user-friendly so that different products can sometimes maybe a little bit confusing when you're first starting off using anything, and therefore this sort of quick brief guide allows them to be able to make their diagnosis, and then from that they can look at the quick reference guide and have a look, okay, this is the product and this is the dosage and the number of days, etc. Just like you'd sort of at dental school, you'd learn, this is the antibiotic, how you'd use it. In a similar way, we've made it very user-friendly for dental surgeons to be able to assist their patient base. So you're probably asking yourself, what exactly is propolis? So bees, as we know, produce things like honey. Everyone's aware of that, but they also produce other substances. And one of the main ones they use for self-defense to protect themselves is propolis. It comes from the Greek word pro and then polis, and it basically means defender of the community. And that's what a beehive is, a community working together, defending themselves. So they sort of gather different resins from plants and trees, and they collect this, and mixing it with their own sort of internal substances, they're able to make this sort of resinous, waxy substance, which they can use physically to seal the hive. So it's quite good in winter, keeping the draft out, but also it has a lot of properties which are very useful in the animal world and of course in the for humans. So it has antibacterial, antiviral, antimycotic properties, and these are very essential. And as dentists, we come across these clinical findings daily. So its use in clinical dentistry and clinical medicine is profound because, as I say, the bees utilize it for themselves, for their defense and their healing, and in human trials, and again we go through this in the paper we've written, it's proven to be very, very effective and has high efficacy in natural immunity building. So it can be used systemically like that, and we can we'll go through how patients can use that preoperatively before any surgery and for surgical post-operative care, but also utilizing it for acute oral pathology. It's a profound substance because it has this resiny wax sort of consistency. A lot of oral products that are out there have a sort of very gel-based, watery-based consistency, and this is actually not conducive to the oral cavity because the saliva just basically washes it away after a few seconds. But the resinous, waxy consistency allows the product, the Propolis, to actually stick to the membrane, to the mucous membrane. So, for example, if someone has an ulcer on the cheek, it physically sticks to the ulcer, and that within itself provides relief for a patient because that immediately sort of seals the area, reduces the pain. And then, of course, the various substances from within the Propolis will assist that patient. For example, we'll go through how it's useful in terms of creating anesthesia. It's been shown using Propolis as a topical anesthetic is very useful. So if someone has an acute ulceration from whatever the cause is, so not only does it have that physical barrier, but also one of the properties of Propolis is the anesthetic property, and that's obviously very powerful anywhere in the body, but in the oral cavity, which people have to use daily, speaking, eating, drinking, etc. If you can physically apply that to the area, seal it, and create anesthesia, it's a win-win situation, really. So globally, we find a lot of health practitioners, dentists, doctors, and allied staff turning towards natural medications. So, we find a lot of dentists looking for alternative treatments. And the reason for this is multi sort of factorial, because we know the rise of antibiotic resistance is a major problem, a global health problem, actually, that the World Health Organization has called a crisis, because we know just sort of pumping patients full of antibiotics, the system internally, therefore, does not build up a natural innate immunity. And therefore, dentists are asking the question and searching for natural products. And Propolis is one of those products, as mentioned, that can be used as an immunity builder. So it can be used systemically as well as locally. And we find a lot of patients coming to us with various viruses and bacterial infections. The first point of call a lot of times for these infections was to give them a course of antibiotics. But again, if it's viral, we know antibiotics will do nothing. And this has actually led to part of this resistance that we're finding, this global health crisis. But also, for example, infections in hospitals, MRSA, methicillin-resistant Staphylococcus aureus, again, a big problem in hospitals. And there are more and more products, and we find even post-operative wound healing care packs that are impregnated with honey and Propolis. And these, again, are very, very powerful because they allow the body to naturally create and fight off the bacterial, fungal, and viral loads. So again, allowing the body to produce its own innate immunity. And over time, this is only beneficial for the human race. It's used in animals as well, and will hopefully help to combat and reduce some of this resistance we're seeing with the overuse of artificial pharmaceuticals like antibiotics. So a lot of times patients present to us with various viruses and bacterial infections, and there's a lot that you as an individual, if you are a patient, can do for yourself. You don't have to wait till you go and see a medical practitioner or the dentist, because Propolis works systemically, meaning that you can take it internally, either as a tablet form, for example, very easy to use. The raw natural Propolis is produced by B Vital, and this can be taken internally, so you can use that to build up your immunity. And for example, if you're suffering from an infection, a virus or a bacteria, this will allow your body's internal system to start producing the various cells which are very useful to boost your immunity. So for example, a lot of oral disease, oral pathology, we see patients with ulceration or fungal infections. it's usually due to a low immunity. So if you boost your immunity internally before you've even seen the dentist, and then going to see them for their acute problem, you'll be able to use the propolis in two ways. So that's one, internally taking it yourself, but also then the dentist can advise you on the different oral products which can assist you in your acute or chronic dental problem that you're facing. So Be Vital has come up with an amazing range of oral healthcare products, really useful for dentists to advise their patients on their use, but also patients can get these products themselves as well. They don't have to wait to see a specialist. Now, some of the common oral ailments that we see and that I treat using propolis are from the more mundane oral aphthous ulceration. And as we know, patients presenting with acute ulceration can be very tender and painful. And as we noted, the actual physical barrier, the resinous wax consistency of the propolis is an amazing barrier which immediately reduces the patient's symptoms and ulceration. And again, because it provides anesthesia, again, that is very powerful in reducing the patient's symptoms immediately. Other oral pathologies that we see are oral candidiasis. That's, a lot of people will know that as maybe oral thrush. And this is caused by the Candida albicans fungus. And this again can present in various forms from the tongue, the mouth, the gum area. And again, angular cheilitis patients who maybe have a reduced occlusal vertical dimension. This creates the fungal infection and cracking of the lips. And this can be very painful for patients. And therefore its use topically applied as a tincture or the cream is very, very useful, again providing sort of almost immediate symptomatic relief. But again, maybe patients who don't remove their dentures often and maybe present with this sort of fungal infection can again apply this to the internal acrylic base of the denture at night time and while they're using the denture, and it's very, very useful again it's being used as a constant sort of topical application, and the actual dentures are quite a nice medium for this. We find again patients with, for example, frictional keratosis, acute lichen planus. They can use this again for symptomatic relief, but over the long period of time, it's chronic diseases such like that. Its use again is very, very powerful because it allows the body to build up this internal system, because obviously even if it's applied topically, an element of that will be internally ingested and can be used for its systematic efficacy. Patients again presenting with cold sores from the herpes virus, again as we noted, the propolis has amazing antiviral, antibacterial and antimycotic uses, so its power in the treatment of things like frictional keratosis and herpes labialis is very profound. One thing that individuals, dentists and again patients may find they suffer from is dentine hypersensitivity. And of course there are various products out there on the market that will be useful for patients, but we usually find patients maybe use one product for a couple of months, it then doesn't work and they switch to something else. And I actually found with family members, and this is how I came across this use more specifically, was with dentine hypersensitivity, is because again the mouthwash, it will look like a normal clear mouthwash. It's very sort of soft on the gums, but because it will have an element of this waxy resin within the deep particles of it, it actually creates a barrier. So there's areas where maybe the patient has sensitivity, acute sensitivity, if there's areas of recession and it's proving difficult for them to have any self-care or treatment for this, we found that the use of the oral mouthwash morning and evening after brushing has been proved very, very useful for patients suffering from this condition. Again, for example, in pediatrics, there may be children with teething, and this can be again very an acute presentation. So parents are very worried, the child is in distress. But as we noted, the actual propolis itself has an internal anesthetic capability, and therefore that anesthesia with its application to the gum proves very, very, very useful for the patient, for the child patient. And again, some of this will be ingested internally, and again the patient may present with pyrexia, with some sort of heat, and again this taken internally can be used very, very powerfully to treat the systemic problem and then the acute oral problem of the teething. These are the main ways that we utilize the Propolis for oral health care. But again, we advise anyone using this to have reference to the book that we've produced, the new book that we've updated, because it does have in there a summary of its uses with case studies, very important, and it goes through the main elements of how to use it, the dosages, and again for clinical safety. Propolis within itself, it's very rare to have any allergy, but again we advise anyone using any product, any natural product, again any dentist advising this to their patients to again ensure that the patient has no known allergy. Of course, if you don't have an allergy, then we advise starting with a low dose, and again the book covers this very systematically to allow you to have confidence to be able to advise your patients to use this. But also as individuals, it will allow you to be able to see the doses you can start off safely, taking the product systemically and applying it topically to whatever oral health or disease process that you may be suffering from. So the Be Vital Oral Healthcare range is very succinct, and it covers and assists us as clinicians to be able to provide the best healthcare we can with these natural products. One of the amazing things I find about the Be Vital, the gel, is its topical application is so easy to use in patients who are suffering from, for example, oral ulceration. And again, I can apply this for them, show them how to use it, but then they themselves can take it home and use it very easily. It's very easy application. So I find the whole range is very, very useful for the different oral pathologies that we're treating. So for example, we were talking about its use internally, systemically, and this can be taken, for example, as the oral Propolis capsules. And this is very easy to use, again, with the different classification we have within the book that we produced. It shows the different dosages. So for example, if someone was going to be having some oral surgery, periodontal surgery, any implant surgery, basically any surgery of the mouth, we would advise patients to take this product internally several weeks before, and depending on their sort of internal innate immunity, if they may be medically compromised, we may ask them to start on a higher dose, for example 3,000 milligrams daily. But example, if someone was generally fit and well, who would sort of be classified as that, who doesn't have any other comorbidity or disease, we may ask them to start on a lower dose. And again, during the post-operative healing time, we find patients who've had any oral surgery that for something, for example, such as the mouthwash is very, very useful because it's very mild. It doesn't have those sort of deep flavors that maybe other mouthwashes have, and patients find that very, very useful, especially if the mouth is very tender after surgery. They can use this very successfully and not sort of add to the quote-unquote trauma that they may have suffered during the surgery, and therefore the healing process is much more comfortable. But we also find, because of the innate properties that we discuss of Propolis, in terms of its anti-inflammatory, antibacterial and antiviral properties, that patients heal, the wounds heal much quicker. So there's a speed increase in healing, but also it fights off and defends the patients from having any potential post-operative risk of any infections. So the oral, the mouthwash is very useful for that. But again, the patients can again use the toothpaste again, which very powerful, mixed with the mouthwash. They can brush again the teeth and the gums gently with this. So the healing sites, maybe with its stitches or sutures, they can use this to assist and make the post-operative healing very, very, very comfortable. Various products are very useful in terms of some have no alcohol and some have alcohol in them. So for example, the Propolis tincture does have its extraction method is with alcohol, but we find this tincture can be very, very useful, again, application to the corners of the mouth. If patients have angular cheilitis, it can be applied very easily with a dropper system into the denture. help with fighting off these fungal infections. But again, with the dropper system, very useful for patients, can apply it specifically to the area of oral ulceration, for example, aphthous ulceration. The mouth and throat spray, again, very, very useful in patients maybe feeling a bit run down, if they're suffering from any viral or increased bacterial load. And again, that can be used, very soothing for the patient to apply. They can spray it exactly where they want in the mouth if there's any tenderness. But again, applying it topically to the throat area is very helpful for the patient, because because of this anesthetic properties, it sort of immediately takes away their discomfort and pain. And again, it's specialized spray system allows it to be used very, very easily by an individual. The one product that I use quite a lot and patients find very, very useful, and again, this is alcohol free, is the Propolis tooth and gum liquid. And this can be, again, applied very easily with the dropper system to the angles of the mouth, to the denture, and specifically to the areas of oral ulceration, or any areas that the patient may be finding difficult to reach. If they have an infection, a gum infection, any abscess, or the patient finds post-operatively after any surgery, if it's quite tender for them to brush and they feel they don't want to use the toothpaste, then they can apply this specifically, even a drop on the finger or drop applied specifically to the anatomical area, provides the anesthesia that we talked about, and helps reduce the bacterial and viral load and fungal load, to basically reduce the chance of any post-operative infections.
Hi, well, we're sitting here in Munir's surgery down in Guildford. I'm James Fernley, by the way, and I started Be Vital 30 years ago, and over those 30 years, I've done a lot of research about this incredible product from the honeybee called Propolis. And one of the most interesting areas that we've discovered and worked with is its use in oral health. And it was maybe 3 or 4 years ago that I met Munir at a conference in Istanbul. And as a result, we've together written a book about the use of Propolis in oral health, and we've conducted some research we've done a meta-analysis of all the different uses of Propolis in treating oral health conditions. So it's been quite a journey, hasn't it, Munir?
Yeah.
And I think we've found something that I think can really make a serious contribution to the growth of interest in and the need for a more natural approach to treating all health problems, but particularly with
I find more and more patients, when they come, they sort of want the alternative to the conventional antibiotics and pharmaceutical range of things that we've been delivering for the last God knows how many years. And I think that trend is increasing. And we find a lot of parents also coming and saying, have you got something natural for my Johnny? I don't want to give him all these tablets, and now I've got something I can really, it's not only about the, if someone's to look at the internal structure of how Propolis works, but just the physical barrier with it, because it's a waxy resin. It sticks to the mouth. It sticks to the oral mucosa, which no other product does. Anything else, it's a gel, it's water, but you put it in the mouth. The mouth is what? It's full of saliva. It's natural. You just wash it away, so they don't actually get any symptomatic relief. Whereas with the Propolis, this tooth and gum liquid, it's phenomenal. You put it on the ulcer, and they're immediate effect.
Yeah.
It's not, you have to wait 5 hours, 10 hours for this to kick in.
Yeah.
It's literally, oh my God, it's like the pain's gone.
Yeah.
And that's, using the internal anesthetic properties of it and all the other wonderful properties, but just that physical barrier is, you can't, there's nothing naturally you can get for the mouth. For that.
Yeah, it's interesting, isn't it? I know there used to be a product used in dentistry many years ago called Whitehead's varnish.
Yes.
I don't know whether you
it was coming to
that.
an extinction by the time I was 30.
Yeah, But I mean, basically what you're doing is you're varnishing the surface, and you're inhibiting the development of inflammation.
Yes, yes.
It's not rocket science.
Yeah.
And you're right. Propolis has those very physical properties, but also plugs in at a very deep level into ways in which your own body can defend itself. I think this is the wonderful thing about it.